Joining me today is Rick Law, Supply Chain Director at Peninsula Health, who will be speaking at IIR's National Hospital Procurement Conference on the 25th of July 2011 in Melbourne. Hi Rick, thanks for joining me today.
Pleasure, how are you, James?
First of all, why was the decision initially made to undertake supply chain reforms at Peninsula Health?
I think the healthcare sector has a real need to become less dependent on government funding in order to not only survive but to expand their operation. Peninsula Health is very much in that category, and there are really some excellent opportunities to achieve supply chain savings across all sectors, simply by challenging, how we currently do things.
How have you implemented process re-engineering?
We've taken a view that all areas need to be involved in this process re-engineering, and it shouldn't be allowed to be just a purchasing activity. So once we got that understanding across all departments, then it was quite easy for people to understand that they actually need to challenge the way they do their processes at the moment. And we adopted the catchphrase that you look at everything from procure to pay processes. So from the moment you are thinking about procuring an item all the way through to its payment.
What have been the results of the reforms thus far?
We've achieved fairly dramatic success in that. We've achieved over $2 million in the last 2 years, and most of the savings we haven't double counted. So after we've achieved the saving the first year, even though the savings are recurrent, we haven't added that on. We've ventured now into new savings. So that's underestimating our position, and really we've still got a long way to go.
So what are the next steps and future opportunities for the scheme?
The next steps is to embed it into more of a culture of the way we do business rather than just a one-off project. And that's certainly happening, because I think that once the departments understand that some of the savings have been achieved, they're very quick to accept the buy-in. And I think the other thing that's really important in implementing this is to have buy-in from the senior executives. Once the senior executive team are on board, then they also help drive the process. So that in our case has been embraced by senior management.
You're speaking at IIR's National Hospital Procurement Conference on the 25th of July 2011, which takes place in Melbourne. How important do you believe events of this nature are for instigating change in the healthcare sector?
Personally, I think it's very critical. I'm one of these people that believe every time you just walk into another person's operations, you pick things up. And only if you pick up one thing, it's still worth it. And I think this sort of conference is great, and I'm looking forward to the exchanges of not only what we've done, but what other people have done. What I intend to do is just to walk through how we've gone about some of our supply chain reforms and just elaborate on some of our experiences.
Finally, what would you like delegates to take away with them from attending your presentation?
I think I'd like them to understand that in all of these cases there's more than one way to achieve your result, and that the real advantage of these sorts of things is to embrace new ideas, to take away what other people are doing and not say necessarily, I'm going to copy that, but taking the idea, taking the concept, and then turning it into your organisation how you best see it fit.
Rick Law, thanks very much for your time today. We're really looking forward to your presentation at the event in July.
Okay, pleasure.